What doctors really think about older patients. The truth you need to know. Have you ever stopped to wonder what your doctor might really be thinking when you walk into the room? It's not something most people want to imagine. But the truth is that behind the polite smiles and professional tone, some doctors hold quiet assumptions about older patients. These beliefs, though rarely spoken out loud, can shape how seriously your symptoms are taken, what treatment options you're offered, and even the level of attention you receive. One of the most common assumptions is that nearly every symptom an older person experiences is just a natural part of aging. Fatigue, memory lapses, joint pain, these are too often brushed aside as just old age instead of being investigated properly. This mindset can be dangerous because it delays diagnosis and treatment of conditions that are often real and treatable. I once knew an older man named Robert who complained of dizziness and exhaustion. His doctor told him to simply rest more, believing it was age catching up with him. Only months later, after Robert pushed for more tests, was it discovered that he had a heart valve problem that could be fixed. Once treated, he regained his energy and wished someone had listened sooner. The lesson here is simple. Not everything is aging, and every new symptom deserves to be taken seriously. Another quiet belief some doctors carry is that older patients won't or can't follow treatment plans the way younger ones do. They may think instructions are too complicated or that multiple medications will be too difficult to manage. Because of this, they sometimes avoid sharing the full range of treatment options, simplifying the plan to the point where patients don't get the complete care they deserve. But age does not automatically mean inability. Many older adults are disciplined, attentive, and even proactive about their health. I recall Carol, a woman in her late 70s, who was eager to understand every option for her heart condition. Her first doctor gave her a basic plan, assuming she wouldn't want more detail. But when she switched doctors, she received a far more detailed, structured plan, and her health improved because of it. What made the difference was not her age, but the way her doctor treated her. It's also true that in some medical settings, younger patients are unconsciously prioritized over older ones. A doctor may assume that a 30-year-old has more to gain from aggressive treatment than someone in their 80s. This bias can affect the urgency of care, the tests ordered, and even the recommendations for surgery. Yet quality of life matters at every age. Richard, an 82-year-old man, wanted relief from his severe knee pain. His first doctor dismissed the idea of surgery, saying it was too much for his age. Richard, however, was active and determined to stay that way. A second opinion changed everything. His new surgeon focused on his overall health, not just his birth date, and Richard went on to recover well from the surgery, enjoying walks he hadn't taken in years. Another hidden reality is that some doctors assume older people no longer have big goals or dreams, that their only priorities are comfort and basic health maintenance. Because of this, they may not suggest more ambitious treatment options, assuming that a patient wouldn't be interested in putting in the effort. But life goals don't vanish with age. Ellen, an 81-year-old woman, longed to travel overseas to visit her granddaughter. Her doctor told her to focus on staying comfortable at home. But when she sought a different opinion, her new physician worked with her, adjusting her medications and building a plan to help her travel safely. Months later, She made the trip and described it as one of the happiest experiences of her life. Her story reminds us that our goals, whether big or small, should always be part of the conversation with our doctor. Perhaps the most overlooked truth is how much the emotional side of aging impacts health. Doctors tend to focus heavily on physical symptoms like blood pressure or lab results, but the emotional toll of loneliness, grief, and change can deeply affect recovery, immunity, and even energy levels. Too often, sadness or anxiety in older adults is brushed aside as normal aging, when in reality, it deserves care and attention. Leonard, who lost his wife of 54 years, began to decline in health after her passing. Every doctor's visit focused only on his medications, never on how he was coping. It wasn't until he began counseling that he regained strength, proving that emotional care is just as important as physical treatment. Hearing these truths may stir frustration, or perhaps recognition if you've experienced them firsthand. But the goal here isn't to make you distrust doctors. It's to give you the confidence to advocate for yourself. AG.